As you guys know, it's exam season and I've been examining again this year. Every time I examine, I see the same mistakes over and over again. So I thought it would be useful for you guys if you knew exactly what these mistakes were, so that you could avoid or even stop making these mistakes altogether. So if you want to know what the mistakes are, then keep watching. Hi everyone and welcome back to my channel. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I work as a portfolio GP. If you are new and you haven't subscribed, then why not consider subscribing, because I have loads of useful content to support you on your medical career journey. As always, if you enjoyed the video, then make sure you give it a thumbs up. So before I get into this video, if you haven't seen my 10 tips for OSCE success, then make sure you check that video out. That video outlines a lot of useful tips and information for you guys to do really well in your OSCEs. Tip number 1, ask only one question when you are taking a history. Many times I see candidates asking several questions all in one go. In many cases, the actor will just answer the last question. So if you want to ensure all your questions are answered, make sure you take the time to ask one question at a time. Tip number 2, do not ask leading questions and don't assume. This is something that I see over and over again. Sometimes candidates will do it multiple times in the history taking station. And once you ask a leading question once, then you're more likely to ask it again. So make sure you avoid this type of questioning. It makes the patient more inclined to agree with you. So that's why it's dangerous to do that. Examples of leading questions are, you don't have X, do you? So X could be, you don't have a headache, do you? Or no headache. So just be really careful in the way that you're asking questions. Tip number 3, ask age or date of birth. You only need one, and make sure you always state your full name and role. This is something that should be done in clinical practice anyway, but of course for your exams, I need to know as an examiner who you are, so I need your full name. I need to cross-check that with the marking scheme. And of course the actor or the patient, they need to know who you are. Yes, you can say I'm a second-year medical student, but get into the habit of stating your full name and of course your role. Tip number 4, don't use phrases like tell me more. How is the actor or the patient going to know what they have to tell you? Be specific when you're asking questions. If someone's presenting complaint is abdominal pain and they come to you and say, oh, I've had a bit of a tummy ache or I've had a tummy upset, don't start off by saying, oh, tell me more. I don't really think that's a very good way to start the consultation. It's very broad, and like I said, how does the patient know what else they're meant to tell you? So like I said, this is very non-specific, it's very broad. The other phrase that I'm not keen on hearing is, have I missed anything? Again, how is the actor going to know, and the patient in real life, going to know if you've missed anything? How are they meant to know this? It's up to you to make sure you haven't missed anything by asking the relevant questions. Tip number 5, it's really good to see a candidate who is fluent in their line of questioning, not hesitant. So of course this comes with practice. That really is the only way you're going to become fluent in your history taking and your examination. But like I said, I've seen many candidates who are very stop and start. This doesn't give a very good impression to me as an examiner. I then think that maybe you haven't practiced enough. So make sure you practice loads so that you become more confident and therefore more fluent in your history taking and examination skills. Tip number 5, have a solid structure in your history taking, but also be flexible. So by this I mean, yes, you've got a structure to follow, but if the patient talks about something else that may be something that you weren't going to talk about there and then, be open to it, don't shut it down. Explore that avenue, open up what the patient is telling you, then go back to your structure. So I always say, make the consultation a bit more of a conversation. The other thing I will say is that as an examiner, I have a mark scheme to follow, so that is in some kind of a structure as well. So if you have a structure, that also helps me, as well as helping yourself and the actor or the patient. Again, what I would say here is that if you feel like you're going to miss something, then usually you will have some paper, and if there's no paper, ask for some, make some notes. Always jot some notes down just to ensure you're not going to miss anything if you feel you might do. Tip number 7, I know it's hard to do, I've done it in exams, but don't use jargon. The patient is not going to understand you, and sometimes the actor will actually say, well, I don't know what this means. What do you mean? So, for example, don't use the word uterus, say your womb or the womb. Try not to use things like hypertension, use blood pressure. So be very mindful, be very conscious of the language that you're using to the patient. You should also try and use language or words that the patient is using. Tip number 8, be conscious of the time. As an examiner, I really shouldn't be reminding you that you should be closing up and that I have to ask you some questions. Yes, in most cases, there will be someone in the exam keeping a track of time and reminding you, whether that's a 2-minute or 3-minute warning, but the onus is on you to keep track of time. Again, this comes with practice. Maybe you can use a timer, but once you get into the flow and once you find your rhythm, you should naturally know when things should be wrapping up. But like I said, I know it's difficult because of nerves, but make sure if there are any warnings in terms of times, then you listen out for them. It can be difficult if you are in the zone or if you are nervous, but it's really important that you listen so that you can wrap up, because you may have to present and you may have to answer questions from the examiner. So ensure you maximize your marks by sticking to time. Tip number 9, explain the relevance of a question. All too often I see candidates jump in with a list of questions and it just sounds so random. To me as an examiner, although I know what you're trying to do, but also to the actor. So make sure that if you are going to start asking a list of whether that's red flag questions, you signpost and you tell the patient exactly what you're going to do next. This helps prepare them to answer any questions that are coming their way, especially if it's sensitive questions, personal questions that they need to be prepared for. The final tip, tip number 10, is when you go to summarize concisely. I don't want to hear the whole history over again. Likewise, I don't want to hear the whole examination all over again. All I want to know are some key findings, some important positives and negatives. So try and keep your summary to a few lines. Finally, just a few more tips. Ensure you listen to the patient and respond. To make sure you listen and respond appropriately. Again, all too often as a candidate, it seems like when you're in the role of doctor, you feel that you have to do everything. Especially if you're playing the role of a junior doctor, an F1 or F2, you're certainly not going to be doing everything. And even as a senior doctor, you're not going to do everything. So say exactly what you would do as a junior doctor, and then say what you would pass on or delegate or get help with from other colleagues. And also make it clear if you're going to refer a patient to get extra tests or to get extra investigations. Don't force ICE, ideas, concerns and expectations. Sometimes the patient's already told you their ICE, so you don't need to explicitly ask that again. Just respond to their ICE and make sure you address it. Like I said, you can take notes before the station starts and during the station. However, it shouldn't hinder you. It shouldn't hinder you being able to develop a rapport with the patient. Don't have your head down writing notes. You don't have to write every single thing. So just be careful when you are taking notes that it doesn't affect how your history taking is going to come across to me as an examiner. And of course to the actor who's ultimately playing a patient. So that's all. I hope you found it useful. Again, like I said, if you haven't seen my video on 10 tips for OSCE success, then check that video out. That's got loads of useful information to help you with your exams. And if you found value in the video, then make sure you give it a thumbs up and subscribe if you haven't already. I will see you in my next video.